Dr. Jackie, board-certified pediatrician, mom of 3, founder of Dove Pediatrics, and your prayerful pediatrician. And today, I wanted to come to you during summer to talk about all of the illnesses that we tend to see in the summer months and that I am already seeing in my office. Before I get started though, I don't want to forget, if you did not have a chance to grab the summer guide, my 101 things to do with your kids over the summer, please comment summer below and we will get that in your hands, because we want to try to prevent your kids from losing all of the information that they did in the past school year, and we want to be able to keep them happy and healthy without just staring at a screen all day. So if you need that guide for 101 things to do with your kids this summer, comment summer in the comments down below and we will get that in your hands. Now on to summer germs and illnesses. I'm here to give you some tips to help them through it, and also to give you some guidance on what is normal, what is okay to watch at home, and what maybe warrants a call to your pediatrician or your doctor's office, or even potentially an urgent care or emergency room visit. When I was thinking about what topics I would like to cover, 3 illnesses came to my mind. Number 1, GI viruses, the infamous stomach bug, vomiting, diarrhea, tummy ache, all the things. Number 2, hand, foot, mouth disease. And then number 3, swimmer's ear. We're going to cover those 3. And if there are any illnesses that you really want me to cover and talk about, please, please, please leave me the comment in the community section. I would love to cover whatever you want to hear about. But these are the 3, usually the most common things that I see in the summertime. So let's get started. GI viruses. What do these look like? These are your typical stomach bugs that usually cause some combination of nausea, vomiting, and diarrhea. Now, some kids get away with just some vomiting. Some kids have more of the diarrhea, and unfortunately, some end up with both. There are many different types of viruses that cause tummy troubles, and what I'm seeing in my area more frequently this year is you might have 1 or 2 maximum days of vomiting and then a whole bunch of diarrhea after that. So important things for you to keep in mind as you're trying to help your child get through it and wondering, what do I need to be worried about? If a child is throwing up but can stay hydrated, they are okay to be monitored at home. Once they are vomiting, make sure that in order to keep them hydrated, you are just giving small sips more frequently throughout the day of things that are not going to be irritating to their stomach. So plain water, maybe even a little bit of watered down juice. You can try some of the rehydration drinks. You want to avoid things that are acidic, things like orange juice or pineapple juice. Those are going to be more irritating to the lining of the stomach and are almost guaranteed to come right back up. Now, here's an important point. It usually takes a number of days of severe repetitive vomiting for a child to become so dehydrated that they need more than just oral rehydration. So rest assured, you might see a decreased urine output in the first 1 or 2 days, but as long as they are peeing at least every 8 hours, which means 3 wet diapers or 3 urinations in a 24-hour period, then they are staying somewhat hydrated. Of course, they have a mild or even sometimes moderate dehydration, but they're not quite at the point where they would need IV hydration. Warning signs are if they can't keep anything down for a prolonged period of time. So for example, if they're vomiting every single time, even when they try to take those tiny sips, and you're starting to see those decreased wet diapers or decreased urine outputs, you may want to talk to your doctor about medication to calm down the vomiting if it is right for your child. The most well-known of these is Zofran, and it does come with its own side effects, so you want to make sure before you just run and grab it from somewhere that it is okay for your child to take it according to your doctor and your child's medical history. Now, of course, there are some homeopathics that can help with nausea, vomiting, and diarrhea. One is Nux vomica, is great for stomach upset and vomiting. And if your child is getting a little bit dehydrated, Cinchona is a great option to help with rehydration after the worst of that illness has passed. Now, after the first 24 to 48 hours, that stomach virus starts moving on down. So they may still have an upset stomach. They may not want to eat. That is okay if they don't want to take solid food for a few days, as long as they are staying hydrated. And if they do want food, or if you are trying to offer something just to keep their intake up, make sure you're offering bland foods. there is irritation that can happen in the stomach lining after you have vomited several times. So anything that has a high sugar content, a high acid content, whether that be oranges, pineapples, and other citrus fruits, or tomato-based, so spaghettis, pizzas, things that have that tomato sauce in them are going to be irritating to the stomach. So stick to things like crackers, toast, maybe even some bananas if they're able to take it, and stick to those things that are not going to be more irritating to the stomach. Now, as that virus moves along down the line, now you may see diarrhea start. We typically do not stop up diarrhea in children, and I wouldn't recommend it for adults either, because if your body is trying to flush it out, you want to allow your body to work the way that God created it to do so. He gave you an immune system that is fighting, and if you stop up that diarrhea by giving medications, you can actually end up with worse stomach cramping and bloating and worse diarrhea later on, especially if it is a bacterial GI infection, and I'll cover why in a moment. So as long as you are able to replace the fluids that they are losing with that diarrhea, you are okay to keep them home. Red flags in terms of diarrhea. If you're seeing any blood in the stool at all, sometimes that is still something that your doctor is going to tell you that we're just going to watch and monitor, but your doctor needs to know about it. So you either let them know or you seek urgent care. And that diarrhea can last a lot longer than we expect vomiting to last, because once you have washed out all of the good gut bacteria with all of that diarrhea, now you may have a transient or a temporary difficulty with digesting certain things, the most common of which is dairy. So if you wipe out the good bacteria that help you to digest and to break down dairy products, you can have lasting diarrhea even beyond the initial illness, lasting a few weeks until that gut finally heals. So the best thing for you to do if you notice, okay, the worst of it is already over, but there's still just looser stool once or twice a day, and it's not quite back to normal, you can try eliminating dairy temporarily. And it's a good idea always to introduce probiotics to reestablish what was lost with that diarrheal illness. Now, what about if this is a potential bacterial GI infection? Because of course, we've got picnics where food is sitting out, we've got travel over the summer where you might be swimming in rivers or ponds or freshwater lakes, and bacteria is a possibility. It's less frequent than viral, but it is out there. So if you do see blood in the stool, like I said, make sure your doctor knows about it. Bacterial infections like E. coli, Salmonella, Shigella, some of them we don't actually want to treat with antibiotics, because as that antibiotic causes a death of those bacteria, some of those bacteria release a toxin. And as that toxin is released, you see a worsening injury to the colon and a worsening diarrhea and then potential blood. We still would want to know what is causing that infection before we decide on a treatment plan. Whew, that's GI illnesses in a nutshell. Next, hand, foot, mouth disease. I answer so many texts and phone calls about the panic of a child exposed to potential hand, foot, mouth disease. What does it even look like? What can you expect? What can you do? First, hand, foot, mouth is a viral infection, which of course, viruses most of the time just have to take their course, and most of us with an intact immune system are able to fight it off okay. They just might be a little bit miserable in the meantime. But hand, foot, mouth usually starts with some red spots, red bumps. Classically, they're on the palms of the hands and the soles of the feet and around the mouth or in the mouth. However, it doesn't always follow the rules, and so many times you'll see hand, foot, mouth bumps that are extending onto the arms, onto the lower legs, around the mouth, onto the face, and even in the diaper area. So it starts out as little red bumps. Those tend to turn into what look like little blisters. They may not be raised, but they just look like there is a bubble between the top layer of skin and what is underneath that. Now, usually at the onset of the illness, possibly even before you see any rash, we expect to see some pretty elevated temperatures. So this is usually landing anywhere between 102 to 104 Fahrenheit for a child. Certainly it could get a little bit higher than that, and some kids have a more mild course where it's a lower grade fever, but you typically see a fever before you see the rash. And then once you see that rash, you know what is coming. Now, after you see the little blister stage, then those blisters will start to crust over or form a little scab or a crust, or just heal and look more like a little scar. And it's once you are in that stage, by then your fever should be resolved and you are no longer contagious. But in the meantime, they can get pretty miserable. If they have sores in the mouth, many times they won't want to eat. And again, if they're not eating solid foods, that's okay, as long as they are taking little sips to stay hydrated. Cold foods or cold drinks, you might notice, help. So cold water, cold juice, popsicles, even a cold rag, washcloth that's been soaked in water and put in the freezer can sometimes be a little bit of a relief in their mouth to those sores if they are in there. Again, if they're becoming dehydrated because they're not wanting to eat, making sure that they're making a wet diaper at least every 8 hours. And if not, please contact your doctor. And it is a great idea, especially if you are in the blister stage, to have your doctor take a look at it. But for the most part, they can be treated at home, just trying to keep them comfortable and hydrated. Ibuprofen goes a long way because not only does it help the fever to come down, but it helps any inflammation. And as these little bodies are trying to fight off this virus, the immune system is doing its job. Of course, it feels yucky. It feels like a whole bunch of inflammation everywhere. So don't be afraid to go ahead and give some Motrin if they really are miserable, they can't sleep, they aren't drinking or eating. That will take some of the edge off. Most children get past hand, foot, mouth in about a week to a week and a half, 2 weeks maximum usually. That fever should not last longer than about 5 to 7 days. And there's a really interesting but kind of scary tip that I want you to know that happens after the fact with hand, foot, mouth. And that is that the child's fingers and toes can peel, and it can even involve the nails. So you may see a whole bunch of peeling around the tips of the fingers and toes, and the nails can actually shed and fall off. The nail will come back. It might look weird for a little while, but it usually does grow back. But it freaks parents out, and for good reason. That would be pretty scary because it happens after the hand, foot, mouth has already resolved, a week to a couple of weeks after. So it's usually not even on your radar that those two things could be connected. And lastly, swimmer's ear. What is swimmer's ear and how do you get it? Well, the answer is in the name. Of course, you usually do get it from swimming in water that gets into the ear canal and allows an infection. Swimmer's ear is an infection of the outer part of the ear canal. And it usually does happen because water is getting into there and it may be contaminated, or it may just disrupt the normal pH in that ear canal and allow bacteria to start growing. What you usually see is drainage from the ear. Sometimes you'll see that on a pillow when a child wakes up, and that will clue you in that there is drainage coming out of the ear. And it usually comes with pain on the outside. So pain when you push on the tragus, or pain when you are wiggling the entire helix and lobe. How is this different from a typical ear infection? Well, a typical ear infection, when we are looking in the ears at every single well visit, we're looking for anything behind the eardrum, which is the middle ear. So an ear infection where you would have to take oral antibiotics is when we see a whole bunch of infected looking fluid behind the eardrum pushing out at us. But unless it got so full that it ruptured the eardrum and now is coming out of the canal, usually it is just very well contained behind that eardrum in that middle part of the ear. A swimmer's ear is all on the outside of the eardrum. It doesn't pass the eardrum and go into the middle ear unless there was already a hole in the eardrum or something poked in from the outside to create a hole. So the difference between a regular ear infection that needs oral antibiotics to get into the middle ear and swimmer's ear is that swimmer's ear can be treated from the outside in. So that's why you typically just see eardrops being placed in there from the outside to treat the infection that is on the outside. The great part of that is that your child doesn't have to take antibiotics that affect their entire body, only in that one area. And the important aftercare after a swimmer's ear is for that entire season, I do recommend that patients wear earplugs anytime that they decide to go swimming so that you don't have a recurrent infection over and over. Because once you've had one, you are a little bit more prone to another one because, again, the pH of your skin in the ear canal has now changed, and it makes you a little bit more susceptible to another infection in that same season. So those are the most common illnesses that I tend to see in the summer. And of course, there are many others. Summer colds still happen, allergies still happen. Influenza still can happen in the summer. There's so many other things that you can come in contact with as well. So stay healthy. Please wash your hands. If you're sick, please don't go to big, large gatherings. But those are the most common things that I figured I would answer before you even have a chance to ask. If there's anything else, again, that you want me to cover, please comment. Let me know so that I can cover it for you. And then don't forget to comment summer down below to get my free 101 things to do with your kids this summer guide. I can't wait to see how many of you complete it and how many fun activities. Please tell me if you're in the process of doing the fun activities. Tell me what you're doing. I'd love to hear it. Don't forget to like, share, because everybody needs to know about these summer germs, and subscribe to continue receiving this content as we continue building a community of Kingdom parents on a mission to raise a healthy and faithful next generation. See you next time.